much for inviting me this evening to address my fellow Jamaicans. Thank you for the warm welcome I received coming home and since I've been here. I must say that I've been very impressed with the consistency of the strategies here to minimize the spread of this deadly virus. Every business that I've accessed, I've had to hold out both hands for a healthy dollop of hand sanitizer and have my temperature taken. So I'm very impressed. I'm also very encouraged to hear that we have vaccines on the island and we have more vaccines coming. So as you may know, I am the first Jamaican American to be vaccinated on December 14th, 2020. When I had the opportunity to be vaccinated, I did not hesitate. I showed up to the site 1 hour earlier, waiting for the vaccine to arrive because I was so eager to get the vaccine. Having worked on the front lines for the past 18 months, as the Prime Minister mentioned before, I'm a critical care nurse. I'm also the director of the Critical Care Nursing Division at Long Island Jewish Medical Center in Queens, which was heavily affected. We were the epicenter of the epicenter in New York. So what I worked were 7 days per week, 16-hour days on my feet. It was all titles out the door. It wasn't Sandra Lindsay, Dr. Sandra Lindsay or Sandra Lindsay, Director of Critical Care. It was Sandra Lindsay, a nurse, because that's what I believe in. I work alongside my team. This is a crisis, and so I'm going to be out there right alongside them in those heavy N95 masks that feel like they're cutting off your face. So I empathize and I sympathize with my fellow frontline workers who are here. I know what it feels like. And even when I went home, some days not even remembering how I got home, I had to be thinking, where am I going to put people when they come in? We can't turn them away. Our mission is to take care of our communities, and we're committed to that. So where are we going to put these patients? And then where am I going to find staff to take care of the patients? So these were the things that I had to deal with every single day. And every day I would leave my house. Sometimes I'd take a video or I'd snap a picture and send to my family and friends. I'm going out to what feels like war, and I don't know if I'm returning. I'm a sleeper, so people know me very well. I could sleep through a storm. And there is one particular night where I got home and I was afraid to close my eyes because I was trembling, I was exhausted, but I couldn't close my eyes because I thought I'd gotten infected. And I said, God, please don't let me die in here alone. But I took out my white rum and I rubbed up myself and I got some tea, turmeric, ginger, garlic, honey, lemon, and I took a shot of that and I said a prayer and I went to bed. I didn't have COVID. It was exhaustion. That's what we had to go through day after day after day. So when I got vaccinated, it was like a burden, a big boulder just rolled off of my shoulders, and I immediately felt protected. I did it because it is my professional obligation to save lives. And I know beyond wearing our masks, which we should always be wearing, because COVID is still here. Beyond meticulous hand hygiene and social distancing, we needed something more powerful, and a vaccine is our best defense against this virus. We've been getting vaccinated for years. This is not new. So please don't let the propaganda on social media prevent us from getting back the health of our country. I also did it because of personal fear. As you heard me said, I was afraid to close my eyes. I was fearful of getting ill, ending up in one of my ICU beds as a patient, or even dying. I was afraid that I would get infected so much that I couldn't be on the front lines with my team. I would feel terribly guilty. I also did it for all of us because I don't, you know, I'm not just one person. I'm part of a larger community. And so I saw it also as my civic obligation to help where I live now, which is the United States, to get out of this predicament that we find ourselves in. And so I'm appealing to you, fellow Jamaicans, to help the country to get out of this predicament that we find ourselves in. Inaction is not an option. It's not just going to miraculously go away. We have the power to take back our lives and our livelihoods right here in our arms. Now, this variant that's going around, as you can see when you look at the United States map, the states that have a higher vaccination rates are not having so much a problem with the variant as states that have a lower vaccination rate. In Jamaica, we have a lower vaccination rate. And so it just leaves room for these variants. If it's not the Delta, it's what's going to come after that to just run rampant and take over our country. If we don't increase our vaccination rates, and again, as Dr. Tufton has said, we have vaccines here, and we expect more coming, so we don't have any excuses. We can beat this. Now, if you're like me and love track and field, I was jumping up in my house during Olympics, and particularly when I saw the team of women that interview, when they came together as a team. It's not one person that did it, it's not two, it's the entire team. And so that's what it's going to take, Jamaicans, for us to come together as a team to fight this virus. So I appeal to you, do not listen to the propaganda on social media. I was supposed to turn into a ghost 24 hours post taking the vaccine, and I am still here in the flesh, and I tell you, it feels good to be home. I pray day and night for God to spare my life, to be here, and so I am so honored to be here, to be addressing you today. I know we can win this. I know we can win this. We have the fastest woman alive. We can run this COVID-19, but it's up to us, and the power is right here in our arms. So I wish you all health, continued success in everything that you're doing, and I'm appealing to you. Work with the government, because we can't get back our life and our livelihoods, and I love to come home. So let's do this together. I am here. Whatever capacity you need me to help in, I am here to help.